What skin treatments are good alternatives to microneedling?
Facial microneedling is a popular skin rejuvenation procedure often performed by a practitioner using a motor-driven device or even at home by a consumer with a derma roller. The principle behind microneedling is to create a controlled injury to the skin so the body heals by producing collagen in the treated area. The word collagen is a popular term used in the aesthetic treatments as it's generally understood to be something to help you look younger. Collagen is a protein that gives your skin strength and resilience. In the skin, the amount of collagen declines by about 1% every year after the age of 25. The question that needs to be asked is whether microneedling is really the best way to induce collagen production. I'll discuss microneedling as well as alternative collagen induction treatments. I was an early adopter of microneedling and have performed this procedure for lines and wrinkles as well as acne scars and general skin quality maintenance. Let's start by appreciating that microneedling is an aggressive treatment. Essentially, your skin is being repeatedly pierced by needles like a sewing machine. This can cause some pain even with topical anesthetic. Although there are some situations in the aesthetic field where some pain is unavoidable, there is a misconception that more skin injury with microneedling will result in greater collagen production. This is not the case, as there is a limit to the collagen production capability. Unfortunately, a lot of people have seen their skin become thinner after aggressive microneedling treatment. An important concept to understand is that the controlled injury model of collagen induction treatment requires time for healing as an essential part of the neocollagenesis process, or the process of inducing new collagen production. The neocollagenesis process requires 3 to 4 weeks of healing between treatment sessions. A common problem with people doing microneedling at home is that they are unaware that healing is needed for the treatment to be effective. So they use a derma roller too frequently to allow for proper healing to occur. As is well established by chemical peels and laser skin resurfacing, the depth of treatment is critical for long-term benefits. Deeper microneedling treatment can leave the skin irritated and even bloody, resulting in significant downtime and limiting when you can return to your usual activities. In my practice, after I gained experience with microneedling, I decided to look at whether there were other ways to get comparable benefits without the trauma to the skin and downtime characteristic of microneedling. Essentially, there are specific lasers which stimulate collagen production, and each laser can be precisely calibrated for depth and energy delivery. For example, we use a Q-switch ND-YAG laser to stimulate collagen and improve skin tone for people with sun-damaged skin. This is a non-ablative treatment, which means your skin remains intact. Another laser I use routinely is the fractional CO2 laser, which does require some downtime, but can also, through energy delivery, effectively tighten the skin. The point is that lasers use the controlled injury model to induce collagen production, but with more precision and control. Stimulating collagen in darker skin types carries a risk of pigmentation problems when using microneedling or laser. A unique treatment we perform a lot that is suitable for all skin types is called skin boosting. In this procedure, I use a device to create microchannels into the skin to deliver rejuvenating factors into the skin. Unlike microneedling, the device is not creating an injury to induce collagen, but rather creating microscopic channels to deliver platelet-rich plasma, or PRP, which stimulates collagen production without trauma. We routinely combine PRP with hyaluronic acid since hyaluronic acid improves the hydration and support that is characteristically lost in aging skin. Skin boosting doesn't require any downtime after treatment and can be conveniently repeated to build on previous results. PRP, or platelet-rich plasma, is a concentration of wound healing and growth factors present in your blood which are activated for healing injuries. Platelet-rich plasma, or PRP, as well as its gel form, PRF, or platelet-rich fibrin, is often applied after microneedling to expedite healing. PRP and PRF can also be used as a standalone procedure for collagen stimulation and skin rejuvenation. For example, I see a lot of patients whose skin has been very aggressively treated with microneedling or thermal energy devices. I place PRP and PRF below the skin to initiate collagen production, new blood supply, and improvement of the fat cell layers directly below the skin. I do this with cannulas, so I avoid repeated injections on the skin surface and minimize the risks for any bruising. The controlled injury model that microneedling is based upon can be effective, but traumatizing the skin doesn't mean better results. In modern life, it's difficult to justify extra days of downtime every few months. I've found that treatments that are easier on your skin and induces collagen, such as the use of lasers, PRP, PRF, and skin boosting, are convenient and can be done regularly without disruption of your busy schedule.